Good day everyone. Our group will report all about chiropractic massage. Chiropractic massage focuses on musculoskeletal and neurological system diseases as well as the implications of these disorders on overall health. So it is a combination of massage therapy with holistic chiropractic methods, and chiropractic primarily focuses on promoting spine and nervous system health. So mainly, the chiropractic massage or practice focuses on muscles, ligaments, bones, that mostly the passage of force and mild pain in our body when we work too much or exerting rapid force. It is also said to be a combination of massage therapy and holistic chiropractic methods with having the same function, which is to release pain of body's different reflexes. The brief history of chiropractic massage. Chiropractic was established in 1895 and the founder is Daniel David Palmer. So in this case, the story behind about how Daniel Palmer contributed or being the said founder is that he claimed to have adjusted a deaf janitor's spine and restored his hearing. In 1895, spinal manipulation was not a new technique, and Palmer never claimed to be the first to employ it to treat sickness. He did, however, claim to be the first to use specific contacts as short leverage points for more precise spinal adjustment. So in the year 1895, the chiropractic was not formally established and there is no recognized techniques, unlike today that it is already built and established. And that time kay Daniel Palmer, he executed by adjusting the spine of deaf janitor and it actually restored his hearing according to him. And by that time, he never claimed to be the first one to employ that this is maybe a treatment. However, he did claim that he is the first one to do that technique. And all 50 states, including the District of Columbia, Puerto Rico, and U.S. Virgin Islands, officially recognize chiropractic as an independent healthcare profession. These countries believes that this kind of practice therapy can benefit them when it comes to improving their health state in more relaxing way, in which it cannot just provide benefits on their physical state, but as well as it can provide benefits in their mental and emotional well-being. So for example, by reducing stress and by giving them positive emotions. And also chiropractic care available to members of armed forces at more than 40 military bases in the US and at nearly 30 Veterans Administration medical facilities. So it was very popular and already practiced sa US even before, especially sa kanilang military-based or armed forces, which is after hard and difficult training. So parang ito yung binibigay na medical care which is available at that time for military forces, which is a good indication naman that actually gives benefits sa kanila. Primarily, it can ease pain and restore their energy. Chiropractic care is provided in such federal programs as Medicare and the Federal Employee Health Benefits Program. So specifically sa United States then, chiropractic is provided in such federal programs to assist by providing health services in the most needed areas. And also, chiropractic is a covered benefit in many traditional insurance policies. According to some reports, as many as 87% of all insured Americans have coverage for chiropractic. So, in the US, which is chiropractic is most likely to practice, so many traditional insurance policies na involved na doon. So, by giving also the services of chiropractic massage or therapy. So, history in the ancient culture about spinal manipulative therapy. So, around 400 BC, Hippocrates, the father of Greek medicine, used manual treatments to treat spinal conditions. So, Hippocrates was the first physician to describe spinal manipulative techniques using gravity. So, for the treatment of specifically for scoliosis. So, in this case, the patient was tied to a ladder and inverted or binaliktad. So, that kind of therapy was 400 BC pa. Next, Buddhist temples dating back over 2,000 years contain depictions of lumbar spine manipulation. So way back 2,000 years ago sa Buddhist temple, so there is some remaining practices of spinal manipulation na discover nila. And beginning in the 16th century in Europe, spinal manipulation was commonly associated with bone setters, tradesmen, and women who learned the craft through family apprenticeship. So, way back 16th century, yung tinatawag na bone setters is parang sila yung provider na nag-treat ng certain bone fractures. So, nag-travel yan sila to treat fractures before pa na-establish yung tinatawag ngayon ng mga chiropractic doctors, which is professional and may proper technique. So, dati, tawag sa kanila specifically in Europe, way back 16th century, is mga bone setters. So, wala pang formal training since wala pang mga technology unlike ngayon. The uses and benefits of chiropractic. So first is to ease pain. So the body releases tension that is causing some of the discomfort as a result of the relaxation that occurs during a massage. The degree of pain is lessened when this tension is reduced. So it means that nakarelease siya ng tension sa body. So main example is for military way back sa US. So like after their difficult training, so this massage will help them to relieve and release pain out of their body. Second, it improves performance. So massage helps to relieve stress, break up adhesions, and scar tissue. It enhances joint mobility and range of motion, and eliminate lactic acid and other toxins from muscle tissue, and this enhances reflexes and balance. So it means that at the end of the day, it restores your energy and it improves pa yung performance mo. Example for your job or other things. So aside from restoration, naga-eliminate din siya ng mga toxins sa body which help to have healthier state. Third is it improves recovery. So massages have a direct effect on the body's generation of serotonin, which is required for the production of melatonin. So melatonin aids in the regulation of sleep and waking patterns, resulting in a healthier night's sleep and improved restoration. So this is most beneficial sa sleep cycle dahil this therapy relaxes not just your body as well as your mind. So nakakatulong siya to improve your sleep cycle in a better phase. Fourth is headache relief. So headaches, like many of the other massage advantages, can be relieved if stress and sleep deprivation are addressed. Headaches are caused by tension, which is caused by the amount of stress you are experiencing as well as a lack of sleep. So headaches induced by tension disappear when massages relieve stress and provide a better night's sleep. So it was also said to help manage headaches caused mainly by stress. So again, this kind of massage help also to relieve stress, means nakalesen siya ng causes ng headaches. Number 5 is it manage anxiety and depression. Massages have long been recognized to calm the receiver and reduce stress levels. As a result of these two factors, it seems likely that massages will also help you to manage your anxiety and sadness. Massages aid in the production of the neurotransmitters serotonin and dopamine, which are both implicated in the treatment of depression. So it also good benefits for those who are facing anxiety or depression kasi it both helps for the relaxation of body and mind, which also gives positive emotions and positive changes sa body ng person. Number 6, it strengthens your immune system. After seeing how massages may help you sleep better and reduce stress, it's an easy calculation to predict that when you combine the two, your immune system will be strengthened. So it also strengthens your immunity mainly by improving your performance, having positive emotion, and much healthier life state. And lastly, it by lowering blood pressure. So according to study, many people who are relieved of their stress also observe a reduction in their blood pressure because massages and stress alleviation go hand in hand. A chiropractic massage can also help you lower your blood pressure. So it's also good for lowering your blood pressure because it improves for balancing your body system.
Next are the conditions that being treated by the doctors of chiropractics, and these are the back pain, neck pain, pain in the joints of the arms or legs, headaches, whiplash injuries, and the sports mild injuries. Next is the different types of the chiropractic massage. First is the craniosacral therapy. It is a mild and non-invasive massage technique for treating the entire musculoskeletal system. The chiropractor employs mild touches to mobilize the connective tissues that surround the spinal cord and brain in the craniosacral therapy. Also, this therapy is a gentle hands-on technique that uses a light touch to examine the membranes and the movements of the fluids in and around the central nervous system. It is also to relieve the tension in the central nervous system that promotes a feeling of well-being by eliminating the pain and boosting health and immunity. Next is the cupping therapy. Cupping therapy involves the placing customized cups on your skin to create a suction-like action. These cups will be used in conjunction with various types of the chiropractic massage. People use this cupping massage over the years to ease the back pain or the neck pain, headaches, and other problems. It also involves creating a suction force to pull blood into the skin. But also, cupping can cause bruising and can lead to skin infection. Last is the drainage massage. It is a mild massage method that aids in the natural outflow of lymph fluid. The lymph transport waste items from your musculoskeletal system to organs that expose them. If this waste builds up in the musculoskeletal system, it will cause inflammation and discomfort. The lymphatic massage is also known as the manual lymphatic drainage that relieves swelling that happens when the medical treatment or illness blocks the lymphatic system. The lymphatic drainage massage involves gently manipulating specific areas of our body to help lymph to move to an area with working lymph vessels. Next are the 5 of the most common used chiropractic techniques by the doctors. The first one is the diversified extremity manipulating or adjusting activator methods, Gonstead, Cox flexion, or the distraction. The first one is the diversified, where it is the most often utilized chiropractic method, and it is also the one that patients are most familiar with. It is a high velocity, low amplitude thrust is used in the diversified manipulation adjustment, which frequently results in a detonation of a joint. This technique is a safe and effective way of relieving stiffness and pain. It is usually associated with a popping noise, which means that the gas is being released from the joint as it is unlocked. Next is the extremity manipulating adjusting. This is when chiropractic manipulation adjustment is used on joints other than the spine, such as the shoulder, elbow, wrist, hand, finger, hip, knee, ankle, foot, toe, and so on. The carpal tunnel syndrome, gait, and posture-related issues are the examples of conditions addressed by extremity manipulation adjustment. This technique where the physical therapist apply a controlled thrust to a joint. The amount of force varies depending on the type of the manipulation that is being used. This is technique utilize a safe and effective low amplitude, high velocity approach. This technique can reduce pain and improve joint mobility. It can be used to treat headaches and other spine-related conditions, such as neck or low back pain. When the joints start moving better, imbalances are corrected and the pain is modulated.
The third chiropractic technique is the activator method. The activator method technique is used to alleviate back and neck pain as well as pains in the extremities, which are the areas outside of the spine. So, to use this technique, chiropractor uses a specific instrument called the activator, which is an adjustment tool that will be further elaborated in the incoming slides. So these techniques involves process of manipulating and adjusting with a handheld spring-loaded tool, which is once again the activator, which is evident at the picture below. So the tool that being held by the chiropractor. So the advantage of using this technique is that the tool creates a lighter and faster thrust compared using hand to manipulate or adjust forces. Furthermore, the pulses applied are specific at localized area that prevents joints from bending or being put in different comprised position. At this slide, let us see how the chiropractor uses the activator method to his patient.
Hello, Dr. Scott Taylor from Southwest Spine and Rehab. We have wonderful Monica here today to show and explain a couple different chiropractic techniques. We're going to talk about the activator technique, very misunderstood type of chiropractic technique. But before we get started, Monica, we're going to have you lie down on your stomach for me, kind of put your head on the table there. Now, we've already evaluated Monica for the type of treatments that we're going to do, but what the activator is, it's an adjustment tool that the chiropractor will use to kind of push on certain vertebrae and areas of the spine, and a small, very gentle impulse is kind of put into the spine. And so instead of using our hands and twisting and kind of turning patients, we will utilize this tool. So instead of hearing an audible crack or a pop, a lot of times the patients will just hear the sound of the activator. And you can see if you watch the tip of the finger here, it throws a very concise impulse in there to help move the joints where they need to be moved. And so, for example, so we've already palpated and kind of felt, Monica, where we're going to work. So her L4 here on the left, so we literally are going to go like this. I kind of do a little, kind of stretch the tissue here, and then you're going to feel 3 to 4 successive little kind of thuds there. And what that's doing is kind of helping the vertebrae move to where it needs to be. In the same process, we'll move all the way up the spine. And so I'll show you again in the upper thoracic spine where she has a lot of tightness kind of in between her shoulder blade and the spine. So we're going to go right off to the side of the spine, and then you're going to see activator adjustment. So it's a tool. It's great for patients that maybe aren't able to tolerate a traditional chiropractic adjustment. Also for patients that have osteoarthritis that's really severe, and also osteoporosis. So some of our elderly patients that their bones are really just not very strong, they might be concerned about going to the chiropractor. There's different tools and different techniques that can be utilized so that we can kind of treat everyone from young children all the way to our most senior patients. Thank you guys. Have a wonderful day.
Next method is the Gongstead technique. Gongstead technique is named after its founder, Clarence Selmer Gongstead, which is an adjustment method used to realign the spine. It is known as one of the most precise and effective method to relieve pain and promote optimal alignment of the spine. So it is a manual or hands-on technique in which a chiropractor adjusts the lower back or the pelvis. So it is done while the patient is lying on his or her side or in a sitting position. This position allows the chiropractor to realign the joints that could make or cause pain, stiffness, or limiting a patient's overall mobility. So, a Gongstead chiropractor take their practice to the next level.
So, Gongstad Chiropractor examined the spine in the following ways, such as the X-ray analysis, palpitation, and temperature gradient investigation are used to clearly understand the problem of the patient and to make better treatment decision. Looking at the image below, the chiropractor is seen to be analyzing his patient's condition with an instrument called the nervoscope, which has the ability to detect inflammation and the nerve pressure up and down the spine. Now, let's see how a chiropractor uses Gongstad technique to his patient.
Hi, this is Dr. Scott Taylor with Southwest Spine and Rehab. I have wonderful Monica here, one of our patients. She's going to help me demonstrate and show you guys what a Gongstad adjustment is. Now, Gongstad adjustment is named after Dr. Clarence Gongstad, a very well-known chiropractor in the Midwest, and he developed a technique in adjusting the entire spine, but it is really well known for his upper cervical adjustments. And so we're going to demonstrate that today. And so it's very similar to a lot of other types of very well-known adjustments. And so as we palpate or kind of feel the neck for the motion here, we can feel on Monica that on the right side here, there's some restrictions and that vertebrae isn't quite where it needs to be. So we're going to do a very gentle adjustment on her. We're going to kind of turn here. And there you go, Gongstad adjustment. And so how'd that feel?
Great.
Okay, wonderful. And so Gongstad adjustment, it's very similar to other adjustments that you may have experienced, but the goal of that is to help realign the spine and very commonly the upper cervical adjustment. But it's a very gentle treatment. It's not very aggressive, but it's very effective.
The last technique is the cox flexion or distraction. This is a chiropractic treatment that involves mechanical and hands-on manipulation or adjustment while the spine is tractioned and bent forward on a special table. This technique is most commonly used to treat cervical and lumbar disc herniations as well as non-disc spinal diseases and to improve spinal joint mobility. The advantage of this technique is that the adjustment is pain-free or painless and even considered comfortable, making it a great option for patients with recent injuries or extra sensitivity to other adjustments. Now, let's watch a video that shows a cox flexion distraction method being used by a chiropractor.
Hi, Dr. Scott Taylor with Southwest Spine and Rehab. Today we have Monica here with us. She's going to help us demonstrate a chiropractic adjustment technique called flexion distraction technique. So Monica, we're going to go and have you lie down on your stomach for me. And you can kind of put your arms on those little armrests right there if you'd like and just be nice and relaxed. So what flexion distraction technique is, it's great for patients with osteoarthritis in the low back. It's great for patients with disc problems, so herniated disc, slip disc, protruded disc, any sort of discogenic pain. It helps to separate and pull the joints apart in the lumbar spine, and it works very well. So we actually utilize a style of table that mechanically will stretch the patient for us. And so there's a little lever down here. You'll hear the machine kind of table come on. And as you can see, what's happening here in the lumbar spine on the patient, on Monica here, that spine is being stretched and kind of pulled apart. Now at first, it's actually a lot slower than this. And then we'll graduate a little bit more to more of a speed and a depth that Monica is showing. But for video purposes, it's good to be able to see that full range of motion. When you're first injured, it's very difficult to do this. And so the table will only move very slightly. And then towards the end, Monica, you want to put your hands on these little handlebars right here? There you go. The patient can kind of actually hold on, and it creates more of a tractional stretch. And again, as the patient graduates and can continue to handle more and more, we add a small little tractional force. So a lot of times at the sacral base or this L5, S1 region, the palm of my hand here, and then Monica, you feel that stretch down there? So it doesn't take a lot of force. Monica's a smaller lady, and so, but what it's doing is that little bit of force is just pulling and stretching those joints apart. And it feels really, really good for patients. And it's a great treatment to treat low back pain and sciatica.
Now, let us know the common materials used in chiropractic care. There are 8 of them, namely chiropractic tables, activator adjustment tool, digital X-ray machine, transcutaneous electrical nerve stimulation, inherent current, cold laser, therapeutic ultrasound, and diagnostic thermal imaging. Chiropractic tables. A chiropractic table is one of the most common chiropractic tools in any business. Since there are many different types of chiropractic tables available today, they vary vastly by a number of different features, including technology, portability, and how they are used for different treatments. Technically, the tables utilized in a clinic are determined by the chiropractor's personal choice or the procedures he or she employs. The following are the examples of the different chiropractic tables used in a clinic. Stationary table. One of the most common table found in a chiropractic clinic and still used today since it is relatively low maintenance and less expensive. Portable table. Built for portability, can be moved and stored easily. Pediatric table. Designed specifically for pediatric patients. Elevation table. Adjustable by height. High-low table. It is like an elevation table, which means it is adjustable by height and can be also positioned vertically. Flexion table. Another common chiropractic table used for flexion distraction technique developed by James M. Cox. Traction table. Used for decompression. Lastly, drop table. Used to impart extra gravitational force to the adjustment. So that's all for the chiropractic tables. So the next one is the activator adjustment tool. The activator adjustment tool is a spring-loaded gadget that you can hold in your hand. It is used by a doctor or a chiropractor to realign vertebra by delivering a mild force at a high pace into the back. So these prevent muscles from seizing or resisting therapy as well as reducing the joint torsion. So this tool is specifically used at the activator technique since it delivers a mild force at a high pace at the specified or target area of the chiropractor. Next is the digital X-ray machines. They are routinely used to diagnose, analyze, and identify abnormalities in the spine. Chiropractors and doctors can save the images, then upload it in a system like ChiroTouch to examine and track the patient's progress over time. So the benefit of using digital X-rays in chiropractic care are the following. It saves time, quick and accurate diagnosis, and safe and effective in evaluating the spine health. So technically, this is the instrument used by the Gongstad chiropractor to visualize and evaluate the entire structure of the spine, including its posture, joints, and disc integrity, potential fractures, and misalignments, to produce sound and effective decision. So that's all for the digital X-ray machine in the chiropractic care.
Another material used in chiropractic is the transcutaneous electrical nerve stimulation. It involves the use of low voltage electric current to treat pain. It comes in a variety of sizes and strength and are battery operated, which allows the patients to use them at home. Another one is the inherent current. It is another type of transcutaneous nerve stimulation. It is the most common type of electrical muscle stimulation used to treat chronic pain resulting from surgery, injury, or trauma. The goal of using interferential current therapy as part of physical therapy or rehab program is to relieve pain and help patients heal faster. Next one is a cold laser. Cold laser is a material that uses low level of light to stimulate healing of injuries and promoting cell function. Therapeutic ultrasound. This therapeutic ultrasound is often used for treating chronic pain and promoting tissue healing. It may be recommended if you experience any of the following conditions, such as carpal tunnel syndrome, shoulder pain, including frozen shoulder. Last one is a diagnostic thermal imaging. Diagnostic thermal imaging, it uses infrared technology to reveal heat caused by friction, electrical resistance, pressure changes, and more. It examines the nervous system and allows the doctor to see how it functions and responds. And that is all for chiropractic massage group. Hope you learned something and have a good day, everyone.